computerized provider order entry emergency department. Power plants serve as the primary catalyst for a number of activities such as orders, diagnostics, and medication administration to be executed by the eCare team. Power plants incorporate evidence-based links to support and assist practice. Access and complete the discharge process for your patient from your patient's chart. All orders contained in the ED Power Plans auto-initiate. Power plans should be used whenever possible to place orders for your patient. Power plans provide the basis for assessing, planning, and evaluating the care of patients with the most common problems managed by the interdisciplinary team. There are no current orders for your patient, so at the top of the order screen, click Add. The filter should be set to Start With. Select the down arrow to the right of the filter, and from the drop-down list, select Starts With. In the Find field, we've typed ED, and the system will search for the ED Power Plans. From the Power Plans that display, select the ED Asthma COPD Power Plan. To display the orders contained in the ED Asthma COPD Power Plan, click Done. Notice the name of the power plan displays above the orders with the status of Initiated Pending, as well as in the View pane. You will accept all of the orders pre-selected in the power plan. In the IV Solutions section, select sodium chloride in 0.9%, 1,000 milliliters, 50 milliliters an hour, IV infusion. Scroll down to Hematology and select CBC with DIF. Scroll down to General Radiology and select X-ray Chest 2 Views. When finished, click Orders for signature. Click Sign when orders are complete. Always remember to refresh your page by clicking the Refresh button in the upper right corner of the Orders window. Your patient's results have arrived. The results from the X-ray show a lower left lobe pneumonia. White blood cell count is 21.4. After reviewing your patient's results in eCare, you have determined that you want to use the ED Pneumonia Antibiotics Power Plan as a guideline for your patient's care. You now want to add the power plan for ED Pneumonia Antibiotics to your patient's chart. Click Add in the Orders Profile window. In the Find field, we've typed ED, and the system will search for the ED Power Plans for you. From the Power Plans that display, select the ED Pneumonia Antibiotics Power Plan. To display the orders contained in the ED Pneumonia Antibiotics Power Plan, click Done. You accept the pre-selected communication order, so leave it as is. In the Medications section, select the Community-Acquired Pneumonia Non-ICU subphase. You decide that the selected antibiotic orders are sufficient for your patient's care. Click the Return to ED Pneumonia Antibiotics button below the subphase orders. Click Orders for signature, and then click Sign. Refresh your screen and you'll see that you've successfully added the orders from the ED Pneumonia Antibiotic Power Plan for your patient. Admit patient to the hospital from the ED. In order to support your patient with basic orders until inpatient orders are placed, you will add the ED CDU Disposition Admission Observation Orders Power Plan. Click Add. From the Add Order screen, select the ED CDU Disposition Admission Observation Orders Power Plan, and then click Done. In the Admit Transfer Discharge section, select Admit to Patient. The Missing Details icon displays, so you must fill in the missing required details for this admit order. Right-click the admit order and select Modify. Required fields are highlighted in yellow. In the Order Details pane, Inpatient Observation Transfer to is highlighted. In the Details Value pane, select Med Surg. Anytime the Details panel displays, it blocks the rest of the power plan orders. If you want to minimize the Details panel to display more orders, simply click the Details down arrow in the top left of the Details panel. Select Admitting Physician and type Daniel, Theodore. When the address book opens, select his name and click OK to close the address book. Reason for inpatient services is highlighted, so you select Severity of Illness from the Detail Values list. The Anticipated Length of Stay fields defaults to 2 midnights or more, and the Anticipated Post-Discharge Plan field defaults to home. These defaulted fields are necessary in order to meet Medicare guidelines. When complete, click Orders for Signature and sign. You have completed the power plan used to place orders to admit your patient to the hospital as an inpatient and to support your patient with basic orders until inpatient orders are placed.